So narrow versus a wide complex ventricular tachycardia. This is a very commonly asked question that kind of shows up. Of course, the first thing you want to do is take a look at the EKG and look at what it's telling you. So if you see wide complexes, which means maybe like a heart rate of 160 to 240 beats per minute, or you see maybe a series of 3 or more PVCs, you should be thinking wide complex tachycardia, which refers to VTAC. That's ventricular tachycardia. Now, risk factors can vary, but they include diuretics because that can cause like hypokalemia, hypomagnesemia. Also, of course, CAD or maybe a history of MI. So a sample question you might get is like a 57-year-old woman who presents to the emergency department after fainting. And she complained of maybe a rapid heartbeat to her coworker just before she passed out, and her EKG is shown below. Now compare that to another patient who is presenting with a tachycardia. But in this case, sure, she still has a heart rate over 100 beats per minute, but this time maybe it's a younger patient, okay? And she may also present with chest pain, shortness of breath, syncope, palpitations, so very, very similar presentation that you might see, but again, when you look at the EKG, it'll show you something different. The P waves will not be visible, okay? They might be hidden under like T waves, but still it's going to be 150 to 250 beats per minute. QRS will look normal, unlike for wide complex tachycardia. Okay, and so risk factors for that include sinus tachycardia, atrial tachycardia, aflutter, AV nodal reentry tachycardia. So what do you do in both cases? Well, for SVT, you just go ahead and you do immediate synchronized direct current cardioversion. Why? Because there's a risk of rapid clinical deterioration. It's a form of low energy electric shock synchronized to the QRS complex specifically, but make sure prior to you doing that, you give the patient enough sedation and analgesia. And for VTAC, if the patient is unstable, you just shock them, or you can also give them amiodarone otherwise.